Congratulations on taking the first step towards restoring control and reclaiming your life. The InterStim test typically takes less than 5 minutes to perform. Remember, those overactive nerves that go to and from the bladder lives down below your spine, next to your tailbone. Our nurses will get you changed into a comfortable gown, walk you over to our sterile procedure room, and position you on your tummy. They'll uncover your backside and wash off your tailbone area. I'll look at your tailbone under X-ray, which helps show me where those little nerves live. I'll give you a couple little numbing injections and then watch myself on X-ray place 2 little thin hair-like wires just under the skin, laying them right next to the nerve. We put one of those wires on each side of your tailbone. Now, during your test, we only stimulate one of the wires at a time, so you can think of the second wire as a backup. If for some reason we're not seeing the improvement that we want with the first wire, the second gives us another opportunity to ensure that you get a good test. Now, once we know that the wires are in a good spot, our nurses tape the little wires to your backside. Since the wires are temporary, the tape is the only thing holding them in place. Kind of like getting an IV. Place the IV, tape it down, take the tape off, and the IV pulls right out. After the nurses finish taping, they'll walk you back to your exam room and you'll get dressed. Our InterStim technician will then connect the little wires to a temporary stimulator you'll wear on an elastic belt underneath your clothing and give you some instructions. During the short test trial, you'll keep up with a daily diary of your symptoms and communicate with your technician each day so we know how well you're doing. Now, we don't expect your symptoms to be perfect, but we do want you to see significant improvement of your symptoms. If we see a 50% or greater improvement, well, there's a great chance that you're going to do well with the long-term therapy. In fact, about 80% of our patients who do this little test see enough improvement to move forward to the implant. Before you leave the office, our nurses will look at the schedule with you and pick out a day for you to come back for the implant. Now, even though the short test procedure isn't that tough, many of our patients tell us that the implant procedure is even easier. Now, for the implant, we use some mild IV sedation so we can make sure that you're comfortable. Now, you may have just a bit of discomfort with the test procedure. The numbing medicine burns a little bit, and the nerves that we're looking for can be a bit tender as we get close. But we want to make sure that we give you the best chance for good results. So it's important that we get right next to those little nerves. Again, the test only takes a few minutes, and I'm sure you're going to do great. I'm really excited to see how well you do with this therapy.